manual therapy interventions for our lower quadrant case. So the patient I would have on his right side, so I could start with a PIVM to help reduce some of his pain and inflammation. Let me have you come a little bit closer to the side, good. And because his pain is pretty high, I want to maybe start in neutral, a little bit of extension to see what we can tolerate at L5. So I have him in a little bit of extension down at L5, and I'm going to place my right thumb on his transverse process of L5. I'm gonna probably do a little bit of L5, S1, and L5. So we'll start with L5. We're going to the transverse process. And I'm gonna stabilize there so that then I can use my left arm to rotate and get some down glide. I'm just gonna start grade 1 because I suspect he has a lot of inflammation and pain, especially being in the acute phase of at least left of a week of when his pain started. Then what I could do is to allow some activation, but also try to improve maybe a little bit of range of motion at the same time, while not provoking pain, is some muscle energy. So I'm gonna have you push your left shoulder into my arm here, hold it, and relax. And this is a very, very small contraction. It's just to see what, push, and relax, what he's willing to do, and if we can gain a little bit more range each time without increasing pain. Push, and relax, good. And just that alone, we're getting a little bit more. Next, so that's the 2 manual therapy techniques I would like to use to start. Next, if we can improve more range, I would like to then do a PEVM of the lower L5 there. So I'm gonna have you turn onto your stomach. I'm gonna do a accessory glide of 5 on 1 and 4 on 5. I'll probably just do 5 on 1 for right now. So because it's his left side, I'll probably start with a central and maybe move to unilateral if you would tolerate it, but I'm gonna do the unilateral that I had mentioned before. So we have PSIS, L5. All right, so I'm gonna come off to the left side. So I had found his spinous process of L5. We're gonna come off to the side, and that is where I'm going to direct my force to a unilateral. And I'm just doing grade 1, so I'm not really bothering to stabilize above or below. I don't think the patient would really necessarily need it at this point in time, just for like grade 1 pain modulation and inflammation. All right, and then after that, the 4th intervention I'd like to use is maybe some overpressure into extension, if we can tolerate that. So I'm gonna have you go up on your elbows. And all I'm gonna do is hands on the pelvis for some overpressure while he tries to push up just a little more and back down. Good, and up and back down. And let's do 3 more. 1, 2, and 3. Good, and come back down. All right, so that's the 4 manual interventions I would like to use to start this patient in terms of reducing their pain, swelling, and improving maybe a little bit of range of motion if we can, so they can stand a little bit better and walk a little bit easier.